Tim Harper, registered nurse, and here to present to you tonight. A young lady, 29-year-old female, comes into the emergency room. Chief complaint is blurry vision in her right eye. And before I go into the room to evaluate her, I noticed her old record showed that she'd been there for a sprained ankle once before. And on the x-ray it showed that she had 2 old fractures of her toes. And she was in there one other time before when she had fallen and gotten stitches on her head. She had missed a step. So she comes into the room, and the doctor goes in and examines her and orders a number of tests. Orders an IV to give her some IV fluids, blood test, does an EKG, a chest x-ray, a urine test, and he orders an MRI with contrast. Then the doctor gets the report, and it says multiple sclerosis, crippler of young adults. And this young lady, one of the goals was to, someone had to go in and tell this patient this, and it's usually the doctor's job to do that. And so it's important to have good support for the person when you're going in there, hopefully a family member or a clergy member. And because it's very devastating news to have someone tell you that. I passed out a thing that shows the different types of multiple sclerosis because it is very misleading. There are several different types of it. Some of them where they kind of have mixed symptoms, they come and they go. Some people it just goes, bam, goes real bad and to where they're bedbound and really, really sick. It's the number one thing about this disease is it can take all the money from the insurance company because they can last a long time and need numerous resources. They can wind up in the intensive care unit. They can wind up on the medical floor. Simple things like a urinary tract infection can knock them down flat. So the number one thing to do is the referrals. Make sure she has a good neurologist to refer to. And the other thing that I put on this paper is the number for the National Multiple Sclerosis Society. They have some wonderful resources, especially on their website, but they have a financial assistance program where they help with some of your bills and help with medical bills and help with financial support. They even have a scholarship program for your children or for the patient if they chose to go back to college. Sometimes employment issues are very important with this disease, and they have to make adjustments in their employment. One of the worst things they suffer from is fatigue, and so it's important with the medications to try to stay away from sedating type medications. Other things are like heat really knock them down. So fatigue and depression are a couple of the biggest things that they have. And there's numerous non-medical things you can do for those things. And then there's some medications that they have. They have, one of the things is one of these parking decals so they can park in the handicaps. They don't have to walk all the way across the parking lot. That seems to help them a lot. And so a number of these things that would get a normal person tired, will double on a person with multiple sclerosis. So I think that the outcome is to be able to treat them on an outpatient basis to make sure everyone's educated on this, family members and the patient, and they have the proper resources, okay, as far as the doctor's offices. Sometimes they need rides to the doctor's office. Sometimes they'll get to a point where they can't drive. Sometimes they'll need equipment like a cane or a walker or a Foley catheter, or maybe one of those special beds so they don't get bed sores and stuff. So there's a number of resources, and if managed properly with the case nursing case manager, these things can decrease the cost of their care. It's a very serious problem. The number one thing I'd like to say is refer them to the National Multiple Sclerosis Society, because there's a lot of charlatans out there and they'll take advantage of people with diseases. Are there any questions?
Is there a new drug out?